Hi, I'm Dr. Justin Davis, and today I'd like to tell you a little bit about syphilis. Now, most people have heard of syphilis, but probably few people know what it actually is. Syphilis is a bacteria called Treponema pallidum, which causes a disease, which is then known as syphilis. It's a sexually transmitted disease, and if left untreated, can cause very terrible symptoms, eventually resulting in disfigurement or even death. Now today, in developed countries, because we have much better treatment for it, the effects of chronic syphilis are much less common. However, back before the 1940s, when penicillin was invented, it was much more common, and in fact, historically, many prominent historical figures have been affected or died from syphilis. Symptoms of syphilis can be divided into 4 stages: primary, secondary, latent, and tertiary syphilis. So primary syphilis is when you first get syphilis symptoms, and typically this will occur anywhere after being exposed to syphilis 10 to 90 days after the exposure. The initial symptoms tend to be a single, although sometimes it can be a few, but most commonly characterized by a single painless ulceration, usually around the area that's been infected. So because this is a sexually transmitted disease, this most often occurs around the genitals, although it can also be around, for example, the tongue, the lips, the mouth, or other parts of the body. Typically, there are a few other symptoms associated with this, and after a week to a few weeks, it'll resolve even without treatment. However, that doesn't mean that the syphilis has actually gone. It just means the symptoms are gone. Next, you may experience secondary syphilis. Secondary syphilis will occur approximately 2 to 10 weeks after the primary syphilis has gotten better. And this will represent a little bit differently. Probably the most classic presentation is when you have a rash. It can occur anywhere on your body, even on the palms or the soles of the feet. And the rash is typically penny-sized, brownish to reddish lesions. You may also experience fever, chills, tiredness, muscle aches along with this. Now, these secondary symptoms of syphilis may come and go for up to a year, but generally will also resolve spontaneously after a certain period of time. The next stage of syphilis, called the latent stage, means that the disease is not active at all. So in this stage, there's no symptoms. Now, there's no telling how long this latent stage will last. Sometimes it will last even up to a lifetime, and someone will no longer have symptoms at all of syphilis. But for some people, after a period of months or typically years, you may develop the next stage of syphilis known as tertiary syphilis. Now, this is by far the worst and most difficult to treat stage of syphilis, where it gets into the nervous system and sometimes some of the organs, particularly the brain and the heart, and begins to affect those, often very seriously, leading to all kinds of neurologic damage, heart damage, and can often even occur, if untreated, over time in death. And the treatment of syphilis, if caught early in the primary or even the secondary stage, is fairly simple with antibiotics. The antibiotic of choice is still an injectable form of penicillin, but if you're allergic to penicillin, don't worry, there's other antibiotic choices. In the tertiary stages of syphilis, there's still treatment, but it's much more difficult to treat, and some of the advanced neurologic symptoms may be irreversible. Now, what can you do to prevent syphilis? Well, as it's a sexually transmitted disease, of course, using safe sex practices, meaning using condoms, knowing your partner, and not having multiple partners, is an excellent way of preventing syphilis. Also, because it has these different stages, if you do have any symptoms that you think could be syphilis, then make sure to have a doctor check them immediately. Even if you don't have these symptoms currently, it's still a very easy blood test to diagnose syphilis. It's also important if you're a mother to have good prenatal care, because one of the tests that we will do is a blood test to make sure that you don't have syphilis, because you certainly don't want to transmit it to the unborn fetus.